Okay, another question I get asked quite a bit. Patient comes in, they see me and they say, Doc, I went and visited my orthopedic surgeon. They told me that there's nothing that they can do at this point, but in about 6 months, a year to come back in and we'll talk about surgery. I'm like, well, what do I do? Well, let's first break that down and see what that means. What that means is the orthopedic surgeon is telling you that at this point, you are not bad enough to need surgery. So that's actually a good thing. So we got to look at that first. That means that you're not bad enough to need surgery. They're not worried about you. You're not an immediate risk of anything. You don't need surgery as of today. That's good news. So that means we can do something else to work on you. The other part of what they're saying, I'll see you in 6 months or a year and we'll reevaluate. What they're saying is that the arthritis that's there, or not there, but they assume will come, is going to get worse without proper treatment. They can't treat it. Orthopedic surgeons don't do that kind of treatment. They only do the surgery. They didn't have anyone to refer you to at the time. So they just said, come back in 6 months or a year and they'll reevaluate. At that point, if the arthritis has gotten worse, then they'll potentially do surgery. Now, the reason that they say this is because they know that as the body moves abnormally, it is dealing with pain, and we have the gating mechanism that goes on, your body will develop osteoarthritis. We want to stop that from happening, but they know that if you don't do any treatment or if you do the wrong treatment, you will get osteoarthritis, you will degenerate, you will have more issues, and then in the future you will need surgery. They don't have any way of doing anything in between until it gets to the surgery thing, so it's not their fault. But that's what they're saying when they tell you that. They're basically saying, right now you don't need me. You may need me in the future and we can evaluate that, but until then, go to someone who specializes in this, because then we can maybe prevent you ever coming back in. But it's good news. You don't need surgery today. That's what we want to hear. So if you have any questions, you can give me a call. We work on patients like this all the time. And I also want to make sure though that everyone understands what's going on. So I always sit down and explain things to patients. And if you ever have any questions, I'm here to answer them.